Kahoots. So here we go with it's 100 questions. It is something that I've been working on for many years. It is going over this, that, and the other, and you'll see what I'm saying. Seeing what sorts of questions, what sort of things might I be looking at? Because I mean, PEDS is a big thing. Now it's a complete, the whole course. It's like everything we got to figure out now. So let's figure out how we can do it. Now, anybody who wants to meet me before their HESI, please send out a message. If you're getting nervous and you're biting your teeth, I am more than willing to help you. The math on the HESI is very simple. It's just desire over half times quantity type questions. There's nothing crazy. If you can do the math on these exams, you do not need to practice math. It is actually pretty okay. All right, let's just get going. I'm going to go as far as I can today. I'm probably going to get through all 100, but I'm going to talk quickly. Thank goodness I'm recording, right? What is probably the single most important influence on growth at all stages of development? You're going to hear this in your sleep, right? Nutrition, 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 nutrition. If you don't put fuel in the tank, cognitively, they're not going to be alert because you're not filling and giving them the food it needs in order to think. And also, fine and gross motor, it's not going to be there because they don't know how to do it. You got to feed the tank. Nutrition, nutrition. How would you initially treat a 6-month-old infant with diagnosed with GERD? So first thing, what do? You notice that your 6-month-old is refluxing. What would be the first treatment? So remember, reflux, the whole big thing is that they're vomiting and they're losing nutrition, right? So we want to do something to hold the food down so they get the nutrition that they ate. A little bit of rice cereal to formula. It's actually when you take the bottle, those little newborn bottles are 2 ounces, right? So you put 5 mLs of rice cereal and then you put 1 ounce of formula, breast milk, whatever. And that's the way you thicken it up. And again, remember, how do we know it worked? Is because that baby's not vomiting as much. The baby's gaining weight. The baby's alert cognitively where they need to be on growth and development. All of that. During assessment on 2-month-old, you notice that the head circumference has increased 2 inches. What should you do next? What is that telling you? 2-month-old. So again, we're seeing increase in head circumference. We're worried about increased pressure, something in the head that's growing. So the next thing is always remember that fontanelle tells you so much on an infant. Fluid balance is right here on a fontanelle. And again, hydrocephalus, you're going to see that also. Frequent developmental assessments are important. Why? Why do I need to see if they're turning over, lifting their head, walking, crawling? Why? So we know that if there's problems, if we see that, let's say at 1 year old, this baby is not crawling, not walking, not attempting, not even trying to scoochy stand up around the couch or whatnot, there's a delay. So what do? Well, it could be just a muscular, they need a little extra help, just like speech. Doesn't mean they're cognitively are going to be delayed child. They need help. So again, early intervention. That's why we do these frequent developmental assessments. If they're behind, we can order it. Speech, physical therapy, OT, whatever they need, we can order it. And the beauty, kids catch up really quickly. A multi. An infant has just received their 2-month set of immunization. Discharge teaching to the parents should be what? What do we know about getting immunizations? Remember, 2 months, 4 months, 6 months, they're getting what? 4 at a time? 2 in each leg, maybe? So the one thing that I have gotten accustomed to, even to myself, whenever I get an immunization like the flu vaccine in my arm, I'm going to be moving it, and try to move it around. In infants, it's in their upper thighs. I pedal them on their back, put their knees up and down like I'm pedaling a bike, and it moves around, that immunization, the liquid they stuck in there, right? We know they're going to get a low grade fever. The body's accepting that antigen and making up their own stuff to protect themselves. We can put a cool pack on there, sometimes a warm pack, depending on the child, but cool will take the heat out. So we don't have to call the doctor for a fever. We know it's expected. The head to tail direction of growth is referred to as what? It's a vocabulary word. And it's just cephalic caudal, right? From the head, cephalic, cephalocaudal. Proximal distal is from here in the middle, what I play with, and now I'm going to play the outside, distally. Proximal to distal, that's the way they start moving around. What is the single most important factor to consider when communicating with children? I'm going to walk into a 3-year-old's room. That's something I got to think about. And again, first of all, before anything, before you get on their level and all that stuff, you've got to know what level they are. So, what developmental level they are. Remember, age does not dictate that because you have some 10-year-olds that developmentally are 3-year-olds. So, again, know your child, get on their level, and you'll be able to get whatever you need done. So, what 2-year-old child pain assessment tool should the nurse use? 2-year-old. You need to know your pain scales, the FLAC, the FACES, and the numeric. Remember, FLAC is faces, legs, activities, crying, consolability, okay? We look at the child. They show us how they feel. That is from 0 up to age 3. Also, any nonverbal child, they could be 18, doesn't matter. They cannot talk, they're going to use FLAC. And faces we can use from 3 up to whenever. I mean, you can do it for an adult if you want, because it's 0 to 10. What's your pain? Same thing as faces. It's faces are showing you 2, 4, 6, 8 on the pain scale. So again, know your pain scales. Important. A child requires ophthalmic ointment to be applied to the eyes. What teaching should your nurse give? What do you know about ophthalmic ointment? Putting it in a kid's eye. So the thing with ointment is number one, you have to prepare the eye to accept the medicine. Clean the eye from the inner canthus, out. Okay, so get that eye clean, remove any debris. Remember, ointment's going to make a blurry vision. A child will freak out if they don't know that. It takes a while for the body heat to melt it. So then it's clear and they can see. Warn the child. According to Erickson, school age children have a prolonged hospitalization should be offered what to promote industry? What is their industry? It's their factory, it's their product, it's what they do well. So, how do you promote that? So, what you're going to do with Erickson, let's say you're offering them something to occupy time, a puzzle or a game. Don't give them something that's easy, they know how to do it. Give them something that will challenge them, but they'll be able to accomplish it. Don't frustrate them. That's what Erickson talks about the school age. Very good, guys. What is priority treatment for a child with dehydration due to profuse vomiting? Kids vomiting. What's treatment? So if they are profusely vomiting, you're putting nothing in their mouth, okay? You need to get IV fluids in. If they are stopped vomiting and they were before, well, then you could offer oral. But right now, at this profuse, it's IV fluids and get your metabolic profile. The first expected fine motor developmental milestone for infants is what? What do they do first? Motor. Remember, motors get up and go, go, go. And fine motor is fingers. So, fingers, fine motor is all about that reflex. When the baby mommy puts the hand next to the baby and they grasp the finger and they go, oh, my baby hugged me. Please don't tell them it was a reflex. Let them think that the baby hugged them. An 8-month-old infant should be expected to perform which fine motor skills? Remember, when you look at these motor skill questions, look, are they fine or gross motors? That's going to tell you, right? Remember, F, fine fingers. G, gross motor, get up and go, 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 like Paw Patrol. So at 8 months, they could be able to grasp the rattle and they're going to have that crude, like sitting at the high chair with Cheerios and like smoosh them in their face. That's a crude pincer. And then it goes to like this, and they take little pieces and they get fine pincer grasp. In general, an infant should triple their birth weight at what months of age? At 1 year old, 12 months, they should triple their birth weight. And again, why do we need to know that? Well, if they're too much or too little, an intervention has to take place. Why? Do they need more food, nutrition, or do they have overnutrition, or is something with the pituitary growth hormone going on? Again, we look at that to find out what's going on with these children. So the RN is assessing a 2.5-year-old toddler should report which finding to the provider. So something here is not right. Report what finding? What's not right? So we know at birth, babies have a huge head and they're just as smaller because the head comes out the birth canal and the chest follows it. By about a year, year and a half, they should be equal. So if it's at 2.5 years old and that head is bigger than the chest, there's a problem. Again, report it. It needs to be investigated. A mother of a 3-month-old infant is concerned because her infant's head is flat in the back. So remember, with young little infants, we promote back to sleep. So the parents aren't concerned because remember, their heads are so soft. They don't get that good molding till, later on. Even healing occurs really quick, remember? So what we tell them is when they go on tummy time, when they're wide awake, that will give that head a chance to keep and we'll round it out. If we need to, they'll put a helmet on, but usually just putting them on tummy time can get that head of that bed all straightened out. A 2-month-old infant has cradle cap. What should the nurse tell the parents to treat it with? So when they have cradle cap. They've got that flaky, dry scalp. So what they say is just wash it with soap and a fine tooth comb and just brush it. You can wash it every day. But sometimes they even say put a little oil on there to clear it up, but it's just you can wash it and that fine tooth comb eventually will get all of those flakes away. What information about introducing solid foods to their 6-month-old infant would you offer? So parents are asking you, how do I feed my kid? So 6 months old, you can start feeding the baby one food at a time every 4 to 7 days. If they're not showing any signs of any allergies, then you could continue feeding that food. So you cannot offer another one because if you mix foods up, what were they allergic to? You don't know. So one at a time every 4 to 7 days. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning what? What do preschoolers know about morality and Kohlberg? Remember Kohlberg and the preschooler, they understand reward and punishment. So there is good and bad behaviors, but they both have consequence, and they know that as reward and punishment. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So, preschooler, ages 3 to about 6. I'm going to teach them. They have to come in to get something done. The biggest thing is number one is to show them. They like to see things. The visuals do help these children. Dolls are very non-threatening, or big stuffed animals, whatever. Show them what they need to do, and this child now will be more cooperative because they know what's going to happen. They're not going to be as afraid. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? I honestly think toddlers are one of the most difficult group of children to get them to do what we want them to do because they're scared, they're afraid. They just want mommy, 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 right? So, number one, give them to mommy, put them on their lap, and then let them play, pushing the button on the blood pressure machine, or let them take my temperature. You taking that little minute, they'll be able to do whatever you want to do because now you're playing. In terms of language and cognitive development, a 4-year-old child would be expected to do what? What do they understand? Cognitive. So Piaget, what's he think? 4-year-old preschooler. A preschooler should be able to follow simple commands. Put your dishes in the sink, put your laundry in the basket. I mean, they should be able to do those sort of things very easily. Parents are concerned her 8-month-old child's not developing like her older child. What is normal for 8 months? Growth and development. 8-month-old should do what? So at 8 months, they should be able to sit alone unsupported, pulling themselves to a sitting position. That's usually about 10 months. Walking, attempting is about 12 months, and putting blocks into a container is about 11 months. An infant presents with signs of dehydration, hunger, and an olive-sized mass in the right upper quadrant. What are you going to monitor for? Infant with a olive-sized mass. What is that? I think it's pyloric stenosis, and that olive-sized mass is the pyloric sphincter that's muscular and thickened, and you can see it. So again, we get this, we look. Number one, if they're vomiting, you're going to ask, is it a dribble or is it projectile? And that would be my first question on this parent for this child. A multi. What would alert the nurse to hold the digoxin on an infant she's caring for? You need to look at vital signs, the normals for different growths and development. You'll see questions like this, and you need to know, is that heart rate normal? Is that blood pressure normal for that age child? Okay. An infant's heart rate should be at birth 140 to 160, about 120 to 140, if a little bit older than that, and up to like 100 by the time they're age one. So a heart rate of less than 90 is way too slow because digoxin slowers and strengthens the contraction. So we don't want it any slower. Ditch level 0.5 to 2. This kid's already ditch toxic. Potassium has to be normal. Remember, 3.5 to 5 is potassium level. And you may only see a child vomiting. Heart rate still might be 100, sort of acceptable. But if an infant is vomiting on digoxin, hold the digoxin, call the doctor. He'll order a dig level if we never had one before that. When taking an adolescent's health history, what's most important? I need to get a history on this adolescent. So I know me as an adolescent, and you're talking health history, there are things I would not want my parents to know. So I would say asking the parents to leave the room, you might get a more honest and a more detailed explanation of why that adolescent is there, in your doctor's office or urgent care or ER, okay? Getting the parents out. Remember, you don't have to tell the parents what that child said unless they can hurt themselves or others. That's the time that you would have to report it. A multi. A 13-year-old status post-umbilical hernia repairs complaining of abdominal swelling, severe pain, and vomiting. What can cause this? So the surgery was an umbilical hernia repair. And now their tummy's all swollen, there's severe pain, they're vomiting. What do you think? So we know that the hernia is the intestines they have to manipulate, especially if they're going back into the kidneys, where at the back of the body, they have to go through all the intestines. You'll always be concerned about a paralytic ileus, okay? Because when you move those intestines around, they don't be happy. They just want to be left alone. So what do? Sometimes NG tube, and we just rest and just IV fluids, antibiotics, and wait it out. And usually it will dissipate by itself. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? How are you going to get a preschooler? They don't want to take it. And trust me, this happens all the time. So the one thing is that straightforward approach. And what I mean by that is, so would you like to take the chewable pill or do you like that orange liquid? Which one would you prefer? Would you like a popsicle when you're done? Would you like a Gatorade or a glass of water? Again, those are the choices, and then they have to give you an answer. And usually you'll get that into them. Which concept reinforces the development of sense of trust for an infant? What does that mean? Sense of trust for an infant. So when we talk about trust and we talk about mistrust, we talk about Erickson. And Erickson says that an infant knows when they cry, somebody picks them up, takes care of their needs, they're happy, healthy, and they have that sense of trust. They can predict what's coming, so they're happy. And that's what that sense of trust is. Remember, the mistrust is when not one time, but all the time, most of the time, the baby cries, nobody goes gets them. It gets to the point where they don't even cry because they know nobody's coming. And it does happen. And infants NPO and unable to take breast or bottle for feedings. What is important to remember? So remember, if they're NPO, don't put anything in their mouth. There's a reason for that. But you want to give them the comfort, the stress reliever, that non-nutritive sucking device, a pacifier. It just gives them comfort. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Like, can you actually tell adolescents about contraceptives? So when you teach an adolescents, what you need is just give them written and oral information and not your opinion. So just the facts is what they're saying. And this is what this question is about. You can give them, you can talk to them and give them written information to talk about. You do not need parents there. If a child comes and asks for it, you can give them the information. The monthly immunization for RSV. And it is Synagis or Pembrolizumab. You'll need to know things like Synagis, prostaglandins, indomethacin. These are some of the terms that I've hit with you're going to need to remember. An infant with hypoplastic left heart's becoming tachypnic, taking a long time to eat, and requires rest. What assessment is priority? What do you need to assess? What do you think is going on? Hypoplastic left heart syndrome, probably the most severe of all the cyanotic heart diseases. The left ventricle doesn't work. It's a big, thick, floppy, non working muscle. So, if they're becoming tachypnic, any cardiac, you see these sort of symptoms tachypnic, long time to eat, and they need these rest periods. Listen to their lungs. They are going into heart failure. Remember, you need oxygen for energy, right? And that's why they're tachypnic. They're trying to breathe, they're trying to get oxygen, and they need rest because they don't have oxygen and now they're tired. So listen to their lungs. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for your placement? You need to this child somewhere on your unit. Okay, so which room do I put them in? Do they need one by themselves, or can I put them with somebody else? And then I need to take care of this child. So this child here, we are going to look at what was their fevers and whatnot. Yes, we need to know that. We need to know the medications, time and stuff, but priority, I want to know, have they gotten their vaccines? If I put this in the room with another child who's gotten vaccine and this didn't, I might be giving the other child something. So it's always a big consideration. When administering antibiotics for a child with pharyngitis, what should you monitor? I mean, it doesn't matter what condition you're giving antibiotics for. What do you watch? Well, You give antibiotics, the first thing you're going to watch out for any allergic reaction, right? Absolutely. Because children, they haven't gotten these antibiotics. So it might be the first time they got it because they could go anaphylactic that quick. Now, if they're in a hospital for a prolonged admission, yes, you would watch the WBCs, making sure that they come down because you're treating them. I understand where you got that, but the first thing is that allergic reaction. When teaching a parent of a newly diagnosed child with ALL, leukemia, what are early signs and symptoms of an infection? So you've got a child you're suspecting leukemia. How do you know when you've got an infection going on? And the thing is, they tell any child with a disease that you're immunosuppressed, whether it's sickle cell, whether it's leukemia, rheumatic fever, rheumatoid arthritis, immunosuppressed conditions. If you have a fever of 100.5, they tell you you need to get medical care. Call the doctor. Remember, you don't have an immune system. So you've got a fever. It needs treated because you could go septic very quickly. Big concept there, okay? Any child immunosuppressed has a fever, they need to call the doctor because they need antibiotics. A 3-year-old is brought to the ER with increased wheezing for the last 2 days, and the child's using an MDI. What is important information? What do you need to know about this? They got an MDI, so they have a rescue, but their wheezing is worse. So, what do you need to know? And again, children, you don't assume everybody knows how to use equipment. Again, did you use a spacer? And if not, get one, show them how to use it. It's something that we can implement. We can use it on infants, 1 year old children, up to 98 years old. It works for everybody. A multi. What is included in the plan of care for a child with cystic fibrosis? So remember, cystic fibrosis is both the chest and nutrition. And it's also the skin because we lose salt, sodium like crazy, electrolytes out the skin. So this is a child that's going to be needing the chest taken care of, aggressive chest PT. Their diet needs to be high protein, high carbohydrates. They don't tolerate fat, so low fat. And they're going to have pancreatic enzymes with their meals to help to digest some of the fat that they possibly can. But no, it doesn't really digest a lot, but it helps a little. And we're going to put them on a high sodium diet. They're like losing salt like crazy through their skin. So I would not put a low sodium, high. Give them a salt shaker. Which information is most important when rheumatic fever is suspected? What is rheumatic fever? How do we get it? There's two conditions in pediatrics I've taught you about. So if you're thinking rheumatic fever, what you're going to do is ask, have you had a sore throat recently? And if that's not a question they don't really know, we could do that ASO titer, the anti-streptolysin titer. That's that strep. We can also detect it that way. So rheumatic fever and acute glomerulonephritis, both caused by strep infections. A multi. What are some assessments that an infant would have if they were in acute respiratory distress? What would they look like? Infants. So the big thing with infants, they're going to look like an adult. They're going to be tachypnea. They're going to have retractions, tachycardia. But infants, they have nasal flaring. And if you hear at the end of a breath this, uh, and you'll see them bobbing also, uh, this child is about to go into respiratory arrest. This is an infant who's extremely ill. So that is the assessments that make infant different than older people, that nasal flaring and grunting. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? What is indomethacin, indocin for? So indomethacin is given to close that duct. Remember, when the baby is born, mommy's hormone prostaglandin is cut off. So when we want that duct open, we give synthetic prostaglandins. Now, if that duct is still open and we're not giving anything, we need to stop wherever it's coming from to stop. So the indomethacin stops it. It says no prostaglandins, no more, and then the duct closes. How do you get an adolescent to open up about their sexual history? So adolescents they're a little bit timid and they're sort of shy and they don't trust. So if you're sitting there talk to them about, oh, I see you have a New York Yankees hat. Do you like New York? Oh, or I like this team. Or you're listening to music. What sort of music you listening to? Or have you decided on college? Or start talking about those things. Now you seem less threatening, and then they will be more apt to open up about themselves. Yes, we might have to have the parents leave the room, but now you, as the nurse, are not as threatening. What is the greatest risk factor for a newborn receiving a cardiac catheterization? And remember, newborns are born with congenital heart disease, so they do get cardiac catheterizations. So, what is our biggest concern? We put that catheter in there, right femoral artery and right femoral vein, and it's a huge, huge vein and artery. Our biggest concern is hemorrhage. They usually don't get infection from that. It's usually not even a question. Our biggest concern is it bleeding. Why the first thing you check on a cardiac cath child is their dressing. Which symptom exhibited by a 3-year-old child with croup is a priority concern? Child is croup. Remember, this is upper airway, and that has to do with inspiratory striders, okay? It's up here, croup. We're concerned because croup can turn into epiglottitis. And the symptom that's showing me that they can't swallow their secretions anymore, it's telling me their airway, everything is closing off. Emergency. Child goes to the ER with respiratory distress. They're anxious, leaning forward, they're drooling. What action is priority? Again, what do you think this is? We're drooling, can't swallow secretions, they're anxious. We think this again is epiglottitis, and your priority is to maintain the airway, right? And maintaining that might mean you need equipment. So you go in the room, get somebody to get the tray or the respiratory cart or the intubation cart, whatever it is, get it into that room with that child because you may have to do an emergency trach at bedside or intubate if you can get that tube in there. A 10-month-old status post VSD repair is receiving their morning meds, 11870, 99, 88, 22. What med should the nurse question? A 10-month-old ventricular septal defect. The bottom chamber had a hole and we fixed it. So this is telling you a heart rate's a little bit low. Absolutely, you're going to question it. It's better to be safe than it is sorry. Good. When assessing a newborn infant, you notice decreased femoral pulses bilaterally. What nursing action should you do next? So you have absolutely or decreased femoral pulses. That means blood supply is not going down. So there's a kink in the hose. This is a coarctation of the aorta. Decreased blood supply, lower extremities. Okay. So lower extremities are lower blood pressure. Upper extremities are getting all the blood. They are getting their blood pressures are higher up there. So that's what you would monitor. Higher and lower, you're almost guaranteed that is a coarctation diagnosis. A multi. When educating adolescents about risk for HIV and hepatitis, what would you include? So with adolescents, again, we would like them to be abstinent, but we know how that is. Condoms, absolutely, and hand washing would be part of that, to make sure. Weekly showers? Absolutely not. At least every other day, right? What discharge teaching would be needed for a toddler diagnosed with hemophilia? Sorry, the baby had a fever, and my daughter wanted to know how much Tylenol to give the baby. Okay, so when you are having any new diagnosis with any sort of bleeding coagulopathy, the thing is always safety, right? And one of the things is, yes, patting the furniture, protecting the environment. A multi. Child with hemophilia has fallen down and the knee's swollen, painful. Treatment would include what? So we know hemophilia, they're bleeders. We know they have fallen, it's swollen, it's filling up with blood. So what would you do? So with hemophilia, you want to stop the bleeding. So we're going to do RICE. We're going to rest, ice, contain, and elevate. Absolutely that. We are not going to exercise the knee that increases blood supply, and we're going to put cold on because we're going to constrict it, not dilate those blood vessels. Discharge teaching for a child with cystic fibrosis about respiratory secretions should include. So we're doing it about respiratory secretions. We know that they get thick and gummy, so we need to do not only the aerosols to keep them open and moving, but that percussion and postural drainage. They got those chest vests now that vibrate because it could be really a lot if we had to do it with our hands at least twice, probably three, sometimes four times a day. Your child with leukemia has had recent lab results and the platelets are 10,000. What's the nursing action? In fact, any child, when you get lab results and their platelet counts are 10,000, what does that mean to you? It's telling you low platelets, this is a bleeding problem. You'll probably see ecchymosis. You might see a little petechial rash. I mean, this is something that needs to be reported. Why is it low? A child starts with a nosebleed for no reason. What action do you do first? First, what do you do? So, nosebleed, you're bleeding out your nose. First thing, thumb, forefinger, and press it. Lean forward, absolutely. But keep it there for 10 minutes. If it's still bleeding afterwards, they need to seek medical care. They need maybe nose tampons, they call them, which put pressure, or sometimes they need to go to surgery and get them cauterized. So, again, we don't want them bleeding that much. And, like, why are they bleeding that much? An 8-year-old semi-conscious boy is brought into the ER. Blood sugars greater than 600, K 6.8, pH 7.12, bicarbs low. Priority action. What do you do first for DKA, isn't it? So, whenever you have DKA, you've got somebody who has a blood sugar that's to the point where it's oozing sugar out of its pores and smells like a big rotten peach, as I call it, that sickening sweet smell. So, you've got to dilute that blood sugar. And at the same time, you're going to give that regular insulin IV and usually a slow, continuous infusion until we get the blood sugars down to a certain level. A child admitted with hypoparathyroidism. What findings would you see that need to be reported to the healthcare provider? What's parathyroid all about? Remember, parathyroid regulates calcium. What does calcium work with? I've always told you calcium, magnesium. Whenever you see them, think of muscles, right? Think of the heart, think of muscles, calcium, magnesium, muscles, all right? So muscle weakness, hypo, less than. A 2.5-year-old child, status post epispadias, yesterday wants to play. What would be appropriate? So they fixed his epispadias yesterday and they want to play. What is an epispadias? That's when the urethra comes on the upper side and not to the end of the penis. So they've had to create a lumen and they've got a catheter hanging out of there. So knowing that, you need to not let them ride a horse, anything that touches that area, no bike, no rocking horse, nothing that's throwing with hard things that could hit them in that area. Putting a puzzle together, sitting down and being quiet, perfect. A child with Kussmaul respiration due to DKA. The increased respiratory rate is trying to compensate for what acid base alteration? I always say the body is really, really neat. One thing goes wrong somewhere, and then somewhere else the body tries to correct it. So in DKA, your body goes into a metabolic acidosis. Your pH goes very, very low, bicarbs low, and your body says, all right, I got to do something to help. So they start with what we call Kussmaul respiration. It's almost like a hyperventilating. And what you're trying to do is blow off acid. So your body goes into the opposite of what it's trying to correct. So you want to correct metabolic acidosis. Your body goes and tries with your lungs respiratory alkalosis. So it changes. You see that? So it works together. When talking with an adolescent regarding personal health concerns, which is most important? So again, just sit there and listen. And again, adolescents, they're going to tell you things that are try to shock you. Try to act there without your jaw just dropping and your eyeballs go big. It's really hard sometimes. In the school age conflict of industry versus inferiority, what does industry mean? Yes, you will have some of your theorists on the exam. They love Erikson infant. They love Erikson school age. They love Kohlberg and the morality. And they love Piaget about thinking and cognitive. So those are things, also to review. Again, industry is my house, my factory. It's what I produce and do well. That's the task I have mastered. Whether it's spelling, whether it's cooking, playing an instrument, I do it well and I feel great about it. A multi. A child with rash, fever, joint inflammation has rheumatic fever. Teaching should include what? So again, rheumatic fever is caused by a strep infection. The treatment is long-term antibiotics to get rid of the strep because that's what's causing it. All of the inflammation of the joints and the rash and the fever and all that stuff. But it does attack the mitral valve. Once it's damaged, it's damaged. It will not get better. Okay, it'll be treated either medically or surgically. Contraindication to administering the varicella vaccine to an adolescent. Varicella vaccines are live vaccines. What do you know about live vaccines and giving them? This is a big concept question here. Remember, when you are taking steroids, you're immunosuppressed. You cannot take a live vaccine. Okay. Early detection of a hearing impairment is critical. Which one is of primary importance? What did I tell you is connected to your hearing? All the time, guaranteed, and it's speech. If you can't speak, check the hearing. In helping a child to adapt to a hospitalization experience, the best approach is again, our big thing is to get that routine and keep it going so that they know what's coming next. Give me 1 second, please. Daniel, I'm teaching. I have an emergency. Just projectile vomited. Projectile. Okay, don't feed him anything. What's his fever? It's okay then. A fever's not going to hurt him. Take his clothes off and wipe his forehead off. And he has like a rash on his penis. On his penis? Yes. Or just take his clothes off, Daniel. Don't give him anything to eat, okay? I'll call you in about 30 minutes. I'll check with you. Bye. Bye. Oh my goodness, poor little thing. Okay, remember, children is always a routine. When assessing vision on a child, the healthcare provider would use the Snelling chart at what distance? So again, it's 20 feet. Again, if you see discrepancies, then you would call the physician. I can't see it this one, to let them know maybe they need further follow-up for glasses. Referrals for cognitive impairment should occur when? You're noticing there's delays in growth and development. When do we do? And it's now, as soon as you can, early, early, early. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Again, any age child, especially the younger children, are afraid of stuff. Let them touch it, feel it, play with it, and then it's not going to be so scary. What acid base imbalance may you see with a child that's having profuse diarrhea? So remember, when you're having diarrhea, you're losing all your digestive enzymes, which are alkaline. What's left? And that's your answer. So what's left is acid. When you throw up, what are you throwing up? Stomach acid. What is left? Metabolic alkalosis for vomiting, and metabolic acidosis for diarrhea, and respiratory alkalosis for hyperventilating. A parent calls because her child is exposed to a child that now has chicken pox. When is she contagious? Chicken pox. So, chicken pox, 2 days before the rash appears, is when they start to be contagious. So, you don't know. So, when you see it break out, whoever the child's been around, it should be notified. And they're contagious to the point until all the lesions are crusted over. Then they can go back to school. No oozy juicy. They have to be crusted and dried over. They can go back to school. What is the nursing priority preoperative intervention for a child with Wilms tumor? What do you know about Wilms tumor? Remember Wilms tumor, it's all about the fragility of that tumor. They don't even do a biopsy before surgery to figure out what it is. They know that the tumor on the kidney, they know it's a Wilms tumor. So do not touch the abdomen, do not do a biopsy, and then they'll do the surgery after chemo, radiation, and they usually do well. Multi. An infant is not past the meconium stool for the first 24 to 36 hours. What would you assess for? That's the meconium ileus, right? And there's things where they should be moving their bowels like almost immediately after they're born. Most infants do. So when they don't, we're going to be looking. One of the things we look for that physical, which would be a Hirschsprung's disease, which is a megacolon, right? That means there's an impaction. Cystic fibrosis also has a problem with meconium stool. Hypothyroidism is the other one. So we'll be doing lab tests, we'll be doing a sweat test, and we'll be doing x-rays. A child with sickle cell disease would most likely exhibit which sign and symptom of a crisis? Sickle cell disease, they usually come in because they hurt so bad they can't handle it anymore and they come in with pain. What's priority treatment for sickle cell? Are you going to treat the pain? Or are you going to treat the cause? You're going to give fluids. And that's always controversial. Fluids or pain medicine. I hang the fluids and I have the pain medicine in my other hand. When teaching the child and family about celiac disease, which of these food items is allowed? Celiac disease. So, celiac disease, no wheat, rye, or barley. They also say oats are contaminated, so none of them. Rice is the one that we should use, rice flour. It is the alternative for a child with celiac disease. It's a gluten problem. A child stepped on an old nail while playing outside. What action should the nurse do first? We're worried about what? Well, we're worried about tetanus for sure. But what do you do first? First of all, we're going to clean that foot and we're going to put antibiotic ointment on it because that's the wound that's the port of entry, right? Yes, we're going to do the bolster and all of those sort of things, but your priority is to clean the wound. A 6-year-old child goes to the ER due to abdominal pain, fever, and vomiting for the last day. What assessment's priority? What do you need to know about that child? They have abdominal pain, fever, and vomiting. I want to know, where is the abdominal pain? I mean, many children come in complaining of abdominal pain. Many of them are umbilicus, and some are, right underneath their xiphoid process. Now, if it's right lower quadrant, oops, that's probably an appendix. And again, it's a different class of treatment. So I want to know where that pain is. A 5-year-old child fell from the monkey bars and is crying because of pain in her arm. What action should the nurse do first? What are we concerned about with breaks? It's always about, if you have a break, we have an injury, you're going to have swelling, and we're going to be worried about, our circulation. So check capillary refill distally of where that swelling is. What is one way to help detect hypo or hyperthyroidism in children? I said, with thyroid disease in children, it is just like adults, except the one thing is growth. The kids are already, they're growing. Adults have already grown. So we will be monitoring the way that they're taking their medicine, if it's enough, if they're being compliant by the height and the weight. We're seeing they're gaining weight, they're gaining height. Cognitively, they're doing what they should do. What would be the most important to report to the healthcare provider for an 8-year-old status post appendectomy with an NG tube to suction? Which there is scary of all of those things? You had an appendectomy. So whether or not, there's a peritonitis with it, you've got a neutrophil count of 400. This child has absolutely no immune system. This child needs to be seen first. He's your priority. He needs to call the doctor. You need antibiotics now. And if he's on antibiotics, he needs more. That is a very sick child that's about to crump and go to the ICU if you don't take care of it now. A multi. Signs and symptoms of hypertrophic pyloric stenosis. This is so scary because it's 3 weeks to 3 months. It's itsy bitsy little babies, and parents are seeing their baby look like the exorcist with this projectile across the room. And I'm telling you, it's 10, 15 feet across the room. You will feel when you have these infants and you ask if they're vomiting a dribble or across the room. When they say across the room, put your hand underneath their xiphoid process and you will feel that little olive. I call it a marble, same thing. It's hard, you can feel it. And it's projectile. It can hit a garbage can 10 feet across the room. And they have a great appetite. They just can't put it in there and keep it there. A multi. A child with chronic kidney disease has renal osteodystrophy. What outcomes would you see? What is osteodystrophy? The kidneys prevent the body from getting quite a few little things that we have to monitor, right? One of them we worry about is vitamin D, and we worry about with the osteodystrophy, then we worry about vitamin D and calcium. We worry about bone pain, slow growth, or being crooked. You could have disfigurement. All of these things you could see with chronic kidney disease if we're not monitoring these levels, and they get osteodystrophy. You suspect an infant has cryptorchidism. How would you examine this infant? So again, testicles that are warm will hang and your testes will be in there the best they can be. If it's cold, they suck back in. So again, have this baby in a warm room, have the best chances of feeling them. A multi. What teaching would you give parents on how a hypospadias is corrected? Epispadias, hypospadias. One's on top, one's on bottom. Remember, the thing is with hypospadias, they cannot be circumcised. This might be some problems in some cultures, some religion, but they need it for the plastic culture. Post-op, and they try to do it before they go potty train, but sometimes they can't. But if they can, you'll see them put a stent in their penis to hold that lumen open, and it's there for like 7 to 10 days. We do nothing with it. We just keep it inside the diaper so urine doesn't go everywhere else. And they fillet the penis open. I sure hope it's not done under local anesthesia. Furthermore, you never put local anesthesia in a tip of anything because it could kill the blood supply and it could cause necrosis. So you absolutely wouldn't use local anesthesia on a penis. A multi. Children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What outcomes do you want to see? So nephrotic syndrome, it's saying the kidneys work, but it's saying protein, which is albumin, oof, I hate you, goodbye. And it urinates it all out, right? So it also pulls it out of the blood. So fluid goes interstitially. So then all of a sudden we give some protein, albumin, put it back in the blood supply. It pulls all the fluid back that's out interstitially, intervascularly, and you start urinating. So urine output increases, the edema is reduced, and because of all that extra pressure that was there, it's going to lower the blood pressure too. What lay of value on one of your clients makes them a priority to see first? There's some interesting lab values there. They're all want to see you first, right? The biggest concern is that neutrophil count of 500. There's no immune system. A white blood cell 20,000, they have an infection. Okay, we need to give them antibiotics. Potassium of 3, yes, they can have cardiac dysrhythmias, but it can wait a second. And a glucose 345. It's not life threatening, but neutrophil count of 500 is life threatening. They need antibiotics now. I won't die. An adolescent with a BMI of 90% is complaining of frequent urination. What tests can you anticipate the healthcare provider doing? So, a BMI of 90%, that means this is an adolescent who's a little overweight, right? Not obese yet. That's more than that, 95. And they're urinating a lot. What causes you to urinate a lot? Well, it could be a urinary tract infection for sure. It also could be the beginning of diabetes, that starting to urinate, um, part of the beginning symptoms. So we do a hemoglobin A1C, and because you're urinating a lot, you are losing potassium. So absolutely, you'll do electrolytes. Very good. What teaching should be done for an adolescent with Hodgkin's lymphoma getting chemo and radiation receive? What do we know about that with Hodgkin's disease? Hodgkin's, non-Hodgkin's, chemo, radiation. One of the biggest concerns is infertility with Hodgkin's. That radiation and chemo, both combinations together, whether it's Hodgkin's, non-Hodgkin's, both of them, big concern. A child falls in a thick bush and he's covered in prickers and he's complaining of severe eye pain. What do you do? So he got prickers in his eye now, huh? So whenever we see something with an eye, if it's floating, we can take it out with a piece of a tissue. If it's stuck in the eye, we don't touch it, don't flush it, nothing it. We take a hard, it's called a Fox shield. It's not like a gauze sort of tissue on there. It's hard, so it won't let the eyelashes or anything touch it, but it protects that until they can get either to ophthalmology or a pediatric ER that can take care of it. A 2-year-old goes to the ER with inconsolable crying and abdominal pain. What finding shows you this is a medical emergency? So they're crying, abdominal pain, 2-year-old. And I should have said sudden onset of painful abdominal pain. This is that current jelly stool, which is our thing that we see with current jelly stool, and it's intussusception. It's a sudden onset, and they're inconsolable. You cannot console these kids while that is sucked up inside. It is painful. When assessing a 2-month-old with vomiting, what questions should you ask the parent? A 2-month-old's vomiting. What do you need to know? Remember, that's that 3 weeks to 3 months area there. I'm asking, are they GERD or are they pyloric stenosis? That's what I'm wondering here. So the forcefulness, is it a dribble or is it projectile? Because it could be reflux or it's going to need a surgical intervention with projectile pyloric stenosis. You notice a 2-year-old child with congenital heart disease, the heart rate's decreasing. What other information is important to report to the doctor? So you have a congenital heart child, heart rate starting to go down. What else are you worried about? 2 years old. A blood pressure of 68 over 44 is a newborn's blood pressure. A 2-year-old should have 190 over 50, 40 at least, okay? So again, that's knowing vital signs here. What priority procedure will you anticipate for a child suspected having Kawasaki disease? What do you think they want to investigate? What is our concern with Kawasaki disease? And how do we check that concern? Our worry about is those little ruptures and aneurysms on the coronary artery, because this is a systemic vascularitis or inflammation of vessels. So the first thing that we do when we can is we do an echo to make sure that there is no aneurysm going on in coronary arteries. A multi. Why do we give aspirin therapy to a child diagnosed with Kawasaki disease? Why do we give aspirin? We're not supposed to give aspirin to kids. So when we give aspirin to them, it's not for a fever. Because remember, you really don't have to treat a fever. Once you have a fever, actually the child is safe. So what is the purpose? We give high dose aspirin because we have an itis. We have inflammation of vessels and we have micro little blood clots going on. And we have inflammation of those vessels and we want to decrease it. Kawasaki is not pain. Okay. It might help with a fever, yes, but it's not the purpose of it. A multi. What lab test should be monitored for a child with congenital hypothyroidism? So T3, T4, TSH, all of your thyroid hormones. The growth hormones, pituitary and luteinizing hormone is more of your pregnancy hormones, isn't it? If I'm not mistaken. A multi. When entering the room of a child, the child becomes stiff and the arms and legs start shaking. What are you going to do? What's your priority here? What do you think is going on? You know, many years ago, when stuff used to happen to a child, we used to throw the parents out. We don't do that anymore. We feel that the parents need to be in there. We just need somebody to be with them to keep them calm. So, yes, you are going to turn them to the side if they're vomiting. Again, the seizure precautions, anything in there, put side rails up, pad the arms, the legs, all of those things for sure. And then, of course, you have to monitor what time did it start? What did it look like? What did you see? For sure. It's documentation. A 3-year-old boy with a waddling gait and falling is admitting for testing. What procedure can you anticipate? A boy, 3 years old, who's starting to waddle and is now falling. What are you suspecting here? He's got weak muscles. He's falling. This is a Duchenne muscular dystrophy, is what they're trying to tell you about. 3-year-old, remember it's 3 to 7 that we see it. They start that waddling gait and they're falling. They get up that Gower sign to get up, and that EMG tests muscle strength. Remember, with that test, they come back like they've ran a marathon. Make sure they get some acetaminophen or ibuprofen because they're going to come back hurting. A mother calls the clinic about her child. She was playing in the woods and has a rash and it's spreading. What over the counter medicine can I give this child? They were in the woods. The rash is spreading. Can I give her an over the counter? And the answer is you can't just say this is something from bugs out there. You should tell them go get medical attention. It could be medicine she took, could be something else. So don't ever assume, say, give them Benadryl or some sort of creams. No, get them to see a doctor. A mother calls the clinic and a friend of her child has ticks from playing in the field. What should you tell the mom to do? So my daughter's friend is ticks. They were together playing in the field. What are you going to tell that mother to do? And we're just going to check her from head to toe for ticks, right? If we see something, we'll let the doctor know. What shouldn't you do to a child diagnosed with impetigo? This is a extremely contagious, ooey juicy, painful scab of staph that could be anywhere. My grandson had it on the back of his calf, and it went from little to almost the whole calf. The one thing with this thing is you can't, there's ooey juice in it. You can't explode it because it spreads it. Okay. We treat it with antibiotics topically and oral antibiotics and cut the nails. An adolescent goes to school nurse complaining of ringing in her ears. What exam should you do first? What would you do? If they're complaining of ringing in the ears, first look inside. Do you know how many things like cockroaches, crayons, earring backs, well, I even seen an ant inside ears? Again, it could be something like that that's causing it. So look in the ear first. A multi. An infant's being discharged after 14 days of vancomycin. What teaching should be included? What are you concerned about with vancomycin? What does that do to the body? What are things you need to monitor? That's what that question's trying to show you. Vancomycin, aminoglucoside, side effects, ototoxicity, and renal toxicity. So you're going to monitor their hearing and their wet diapers. Yes, we are. They're already done with vancomycin. We don't need any more trough anythings. And an infant doesn't get NSAIDs till they're 6 months old, only acetaminophen. And last question, a multi. When checking the lab values of a child with hypothyroidism, what lab values would you look at? Give it to you one more time. So T3, T4, TSH. Yes, we will. KJ, Natalie. Number one is, drum roll, bing, EB. We got an EB. We got a BT, we got an NT, we have an MOUSC. As long as you sat there, listened to it, gained something from it, I don't care what your name is on these Kahoots. Anyway, guys, that's our day today. Remember, you still have stuff that are due, discussion question, a case study, and the practice exam. The practice exam should just populate over. If it doesn't, fill out a help desk ticket or let me know. We'll both fill one out to get it done. I understand you need the dosage count form again. I'll send it to you again on the announcements tonight so that you do have it again. If anybody couldn't open it, whatever, I'm not going to hold you late, so don't worry about that. Grades, when are they coming out? I'm trying to get everybody together for Friday evening after I teach. So maybe about 7 o'clock on Friday night, if I can get my team together. If not, be by noon on Saturday.